Good afternoon, everyone. I-
Good afternoon, Rakesh. This is Dr. Kannan, sir.
Yeah. How are you, Dr. Professor Kannan? Good. Nice to see you on a virtual platform. Yeah.
I'll inform my honorable Vice Chancellor, sir. So, 1 minute. Thanks for joining from England, sir.
Pleasure, sir. Pleasure.
go on.
मॉर्निंग राकेश साहब।
नमस्कार, प्रणाम।
प्रणाम प्रणाम। और यूके में हैं आप?
हाँ, यूके में है सर।
ओके, नाइस नाइस टू वेलकम। वी विल स्टार्ट नाउ सर।
Good afternoon. We will start the SBV webinar, SBV Connect. To introduce myself, I'm Senthil, Professor of Public Health Dentistry. So I will be moderating the entire session today. I'm also holding the capacity of Deputy Director, SBV MIPTech and SBV MGM Bio Incubator. So as one of the initiatives of Sri Balaji Vidyapeeth University from Pondicherry, this is the 22nd webinar on SBV Connect, title Increasing the Delivery of Preventive Healthcare and its Association with Health Sciences University, which is need of the hour because India is moving towards the Sustainable Development Goals, which has to be achieved by the Government of India in 2030. To achieve these targets, one of the targets recently, the Prime Minister of India also has declared by 2025, tuberculosis will be eliminated 5 years ahead of the global targets. That's the commitments the Indian government is moving forward also in every parameters when it comes to healthcare. With respect to COVID measures also, we have a lot of integrated preventive measures have been taken. So to enlightening all these things, today we have 3 esteemed speakers heading different organizations are going to represent Pan India, and they are going to share their experiences about preventive healthcare and its association in their health sciences university. So let us move on to the first session. Let me introduce the speaker for the first session. So the first session, the topic is going to be on key features of systems necessary for delivery of preventive services. So which will be deliberated by the honorable resource person. Sir is Professor Rakesh Kumar Mudugala. He is presently Honorable Vice Chancellor D.Y. Patel Educational Society, an institute deemed to be University Kolhapur, Maharashtra. Professor Rakesh Kumar Mudugala has received specialized training in productive management and has undergone faculty training at IIM Bangalore. His teaching and coaching abilities, coupled with his passion-led style of leadership, has allowed him to build institutions with huge scales. He was earlier a Vice Chancellor of Tirthakar Mahavir University, Moradabad. Sir has 37 indexed national and international publications. He has guided around 15 PhD students. His commitments towards higher education system has got him a lot of laurels, accolades like Gem of YMCA IE, Visionary Award, Leader of Hindustan Unilever. And he has also been the 100 most influential Vice Chancellors awarded at the World Educational Congress 2016 and Best Vice Chancellor Award at Pension 8 Rajiv Gandhi Excellency Award. He's an avid reader. He's inspiring mutual respect and trust among his team with inclusive, transparent, and participatory administrative style of working has made him with great achievements. Sir, over to you, sir, for the first session.
Thank you.
And kind notice to the participants, if you have any questions, you can raise it on the chat box. So I will, at the end of the session, we'll plan it to have a plenary. Thank you.
Hi,
Sir,
good evening.
it's not audible, sir. You need to.
It's not audible.
Sir. Sir, it is not audible.
I need to increase some volume.
Yeah, now it is
Audible now?
fine, sir. Yeah,
It's fine now?
Yeah, fine, sir.
Fine. My heartiest greeting and good evening to all. And especially my respect goes to Professor Pariza and Dr. Mahapatra, who has joined as a resource person also. And Dr. Pariza is one of the ideologistic mentor for me in various aspects when I enter into higher education, because I'm a person who has a later entry into education from industry. So that way I got a great coaching from people like Professor Pariza and of a similar stature. So not taking much time, I just switched to the topic allotted to me. We will be talking about the system as such and what are essentially we need to do for a preventive aspect of things. Like first we need to understand what is the system, because what happens is most of the time we don't understand what is the reachability of a particular concept, and in the process we fail to really apply and implement those concepts so that we are able to reap the real benefit that system is basically holding with it. So in a system, the smallest activity is an act which is basically have a capability and commitment to convert input into output. And we are always in a situation where we are basically aiming to convert resources into results for rewards. Those could be monetary reward, it could be non-monetary reward, or basically ultimately creating an impact as such. So the activity is the smallest act which converts input into output, and set of activities are known as a process. And that is very, very important aspect I wish to say, because the productivity is basically the measure of goodness of the process as such. And everybody is basically aiming at that we should be having a high productivity with a low wastivity, because there's a relationship between productivity and wastivity, and they are inversely proportional. Higher the productivity, low is the wastivity. Hence, to increase productivity in any system, because that's the measure of a system, how productive that system is. And we have to basically aim at reducing the waste. That could be the target, should be the minimum waste, or it is utilizing of waste, or basically creating conditions where we are able to minimize it, right? This is how it happens. And the essential part for a process is basically leading to a system where interaction between the processes and there's a interconnection. If they are not connected and they're not interacting, say for example, we have got a respiratory system. When there's no interaction and there's no interconnection, what is going to happen? We all know, being from a medical field as such. And we have to develop a system thinking, which basically able to give us a competence to understand how every aspect or every element of a system is able to influence the process. And there has to be 5 essential parts when we are basically going to really talk about the system thinking, because that system will only lead to the efficiency and effectiveness of entire activity we undertake. We have to understand and appreciate and acknowledge and apply that we are living in interdependent realities, and that particular thing we have to understand. But the quantum of maturity goes from dependent, independent, and interdependent, and the focus remains on when we talk about interdependent realities. Then there is a lot of sequences happening in a delivery system, also a lot of sequences. And the poor performance, basically, if we are only focusing on one element of a thing, we are only basically are able to create a relocation type of thing of a problem, not basically resolving and solving the problem. And then for driving every system, we need to have a structure which is basically appropriate, which drives all those type of initiative, and all those models that first happen in mind and they influence every action part. This is how it is. In a pictorial representation, this is how we go about. This is how we have always a need, because need drives. When there's a need of the cells in the body are deprived of food, there's a need for food, and accordingly we take up all those actions and leading into things. Hence, this is very, very important. But most of the time, what we do is we basically stop at the output, and we are not going further the outcome and ultimately the impact. What is essentially more important is that how it is impacting us. Like when we have got outcome-based education now, definitely we are moving from a system of input to output to outcome, and ultimately it should be impacting. And the basic purpose is that it should basically give us the desired results, right? And to have this, these are 5 essential things we have to keep in mind. We might design any good process, we develop good systems, but if the process and system owner does not exist, it is not going to sustain. Like in the opening remarks that we were talking about the sustainable development goal. Because sustainability will only come when the first person fundamental thing that if somebody is going to own that process, somebody has to own that system. That yes, that system belongs to me, and I'm committed to really see to it that it is able to deliver us efficiently and effectively the desired results. Then process is defined. If something is not defined, then doing becomes slightly challenging, right? Because first we need to define and then do it. At times, in case something we are not able to define, definitely we can resort to the reverse approach also, that we do things and then start defining the things, so that for the next standard operating procedure we are better equipped. Then process is documented, the process linkages are established, process is monitored, and the records are maintained. If we are able to really have all these 6 activities, definitely we are creating a system wherein we are sure about that outcomes and impacts are going to be really very, very desirable ones, and they are the relevant ones, right? as we all now we move to, because giving a small what you call basis and the foundation of the understanding related to the system, we are now moving to the what the health system is all about. What are the various constituents? All organizations basically who are involved into improvement in the health, because that's the essential aspect. That could be a physical health, that could be a mental health. At times we talk about, of course, the spiritual aspect also, but we will more limit into physiological and psychological aspects of health improvement or the various parameters. And every activity that basically we are aiming at, that there should be an improvement from the current state of affair to the desired. It should be able to march towards the desired state of affair. And there is a need of a whole lot of people. We need, of course, the staff, because ultimately it is the old saying, that for every there's a person has to be in the center of things, because the person is able to create everything which are essentially needed and created for him or her. Right? We need staff, we need funds, there has to be an information, and that ultimately the information should be basically, we should be able to migrate that information in creating the knowledge and ultimately culminate into the wisdom aspect, where we are fully equipped by bridging the what you call a relationship between knowledge through understanding to wisdom. Then, of course, the supplies are needed because materials are important. Then bringing the healthcare services at the doorstep or at the necessary location are important. There has to be communication. There has to be total guidance and direction in its entire functioning. That is essentially is a part of the system. It's a very, very complex, demanding, and really it is needed type of thing. These are all we are fully familiar, being into a health sciences university part, that yes, there is a complete pyramid related to healthcare services. The foundation is the basically population-based health services. Then ultimately we clinicians, we provide all those services which are needed. Then goes to the primary healthcare, the secondary and tertiary aspect. But the focus in every delivery system, or not only delivery system, basically it is a design and development to delivery, that we need to focus entire efforts or the major efforts to basically managing health and instead of illness. That's if you are able to manage health, definitely it is going to be the elimination of illness as such, or minimization of illness. Emphasis has to be on the wellness of the population, and we have to create conditions or policies or systems where we are able to prevent the injury aspect, whether it is a physical or mental injury as such. Right. Now, this is a model which has been propagated by WHO. That these are the 6 building blocks of a good health system, or the health system as such, that there has to, because health comes primarily as a part of the service sector, not as a manufacturing sector, and that there's a challenging aspect. These services are created and delivered simultaneously, not like product which can be inventoried. Service delivery, health workforce, because when health workforce is really fully equipped, they will be able to deliver these services. Health information system, because information is a new what you call oil which is flowing into every system as such. Then access to essential medicines. It is not only that every disease or illness or ailment can be treated without medicine, and if the medicines are required or prescribed, definitely they have to be made available. The money makes the mayor go. Definitely finances are important, and the top of that, the leadership, because leadership and governance is something which is going to bind all these things, because organization, they are the shadow of the top man as such. And then this is access to entire coverage, then quality aspects and safety aspects, that yes, it should result into the improved health in terms of level and equity. Then there has to be responsiveness, because in a service industry, the responsiveness is a very, very important aspect. And social and financial risk protection, and ultimately improving the efficiency of the system as such. These are the 5 different facets of things that yes, the most important aspect is the promotive aspect of things, that we promote health. But that cannot happen in every situation, in every setting as such. Then we need to really focus on preventive aspect of things. If that is also not possible, then we basically move on to the curative aspect of things and habilitated and elevated as in between. But ultimately, what essentially needs to be kept in mind, that these are delivery system in every 5 dimension or interventions are to be responsive, and they have to be financially fair so that we are able to treat the people respectively. That's the essential part, because there has to be in time things available that we are able to create conditions of ability to respond to situations. And of course, we cannot create a system of healthcare delivery where as the population is not able to really what to call manage with their financial resources available, or that is not financially viable or affordable rather to them. That is how these all 5 interventions, which are very, very important, as we have been what to call hearing to the very, very old aged and saying that prevention is better than cure. This is true. Coming from industrial background, we have been using a very important simple tool in quality management, which basically says 1:10:100, and applying into this setting basically gives an understanding and learning that if prevention costs us 1 unit of cost in any aspect, that what you call repair or curative aspect will cost 10 times and failure will cost us 100 times. The product is failing, it is going to be 100 times the preventive cost. That is how particular things. Hence, prevention definitely better than cure. But if prevention is not possible because the limitations into the system, the reachability and whatnot, then definitely we have to resort to the curative. And once curative is there, that it has to be fully supported by the rehabilitative aspect of things. This is very, very important that we have to understand the stakeholders into the entire delivery system. The clinician, that's the key to every delivery into the preventive aspect of things. Then, of course, if the community is not coming forward, the NGOs and all, they are not coming forward. It's very, very difficult looking into the size of our country to really cater to all these needs by the clinicians only. But the average is not very what to call favorable as of now. We need to have more clinicians, the institution producing and people working in these settings, and especially in the community medicine. That is very, very important, because that's the department which can really focus more onto the preventive and promotive aspect of things and reducing the cost of healthcare as well as the suffering. Then, of course, these national, state, and local leadership has to come forward, and they have to be using all those authority, responsibility, and accountability all together. Then funding is needed. They have to be looped in, or they have to roped in to build the supporting infrastructure, and the policies has to be there. Like we have seen in a COVID, how nicely the policy has been designed and delivered when it came to vaccination and complete integration of the entire country into that particular system. And that has been possible. Of course, the policy has been designed, they have been documented and communicated thoroughly. And then information system, accordingly, they have been delivered also. And there has to be a management support, and decision has to be taken well in time. That's how these all essential parts. But if you look into the reality aspect of things, the challenge remains there is a very, very poor, or in most of the situations, the missing coordination between these settings, resulting into the all inefficiency and not the benefit reaching to the real person. And we need to close this gap so that we are able to reduce the morbidity also and the mortality also. And that is both in the clinical as well as the community setting. People expect that everything will be handled by clinicians, because looking into the ratio, it's very, really difficult, and community has to come forward. These are the preventive what to call services which we as clinicians, we have been providing so nicely over the past, and definitely we are committed to do it. The immunization part, the screening test, the preventive medication, and of course the health behavior counseling. That's important. And looking into the current situation of our lifestyle, things are changing differently. Hence, things have to be properly measured, because when we talk about the screening test, we are basically measuring those essential things so that we are able to take the corrective actions. And when it comes to delivering the things, it has to be properly built into the entire system of our information, because something which cannot be measured, it is very difficult to manage. And if we cannot manage, definitely it is very challenging to improve it also. Then we have to keep on evolving what to call the mechanisms for measuring and screening for disease, whatever are prevalent in a particular region. like because of the health style related issues, things are what we call, we are moving into obesity, we are having hypertension, cholesterols are going up, diabetics are increasing because people are what we call resorting to the easily available drugs, tobacco and whatnot. But if we are able to really educate people on a health behavior issues, then definitely we'll be able to really curtail and we'll be able to prevent this. There are all challenges involved with it, but how we can deliver it. It is like why it has been that vaccination for COVID has been successful, because the system basically reached to the people. It started with the state of Rajasthan. That door-to-door vaccination campaign was basically planned and executed, and we are able to really reap the benefit. Hence, we have to reach to the people whether at the place of their residence or where they're working, or maybe educational institution or sports stadium or whatever the thing is. And there has to be a proper capturing of that information so that timely decisions can be taken, and community has to be engaged. That's very, very important. This is a simple model of engagement, then execution, and then of course the feedback loop of it. That through engagement, what basically that system will ensure that it is able to generate the awareness, because the first step towards acceptance and reaping the benefit is basically through the awareness part of it, that the preventive aspects is costing less, it is increasing productivity, and it is what they call leading to less of sufferings on every aspect of the life. First, we generate awareness, then we identify and motivate to need these services. Then we educate about the current conditions and the services which are essentially to be provided, encourage people for acceptance of service, because there is it has been an experience in past that yes, people they are hesitant in accepting services. If you recall some of the what they call press clippings and reportings, that yes, in some of the communities people were adverse to accepting the vaccine. Then assist in making the service decision, coordinate logistics, and then transport to the received service. With that, because everybody cannot reach to the place of the services provided, then there has to be complete. Then we basically administer all those immunization, administer and have the interpretation of screening tests, then counsel and support adoption of healthy behavior, and prescribe a medication after risk and benefit analysis. And then ultimately the follow-up is very, very important, and that there most of the things they suffer, because designing something on a drawing board and then implementing on the ground are two different things, and we need to be very, very careful that follow-up aspects are important. Then in that, essentially what we focus is on these 6 aspects: the document, service delivery, and results. Because if something is not documented, it's very difficult to refer back what has been done, and it's very easy to forget the intervention provided and the benefit we are able to reap, not only from the current situation but for the futuristic aspect of research and further development. Refer to those with the abnormal finding for further management, ensure proper follow-up of those who has been referred, support maintenance of healthy behavior, monitor and support medication adherence, because people live in between the medication part, and issue reminder when services are due. If we are able to really create this particular stages thoroughly, we will be able to really reap the benefit of the preventive healthcare delivery system. These are 8 essential aspects whenever we are designing any services related to healthcare. It has to be comprehensive, because it has to basically address the appropriately the need of the target population, whether it is promotive, preventive, or curative aspects. Right? Then we might have created, but do we have the accessibility to that service? That's important. Can we really reach to without the barrier of cost, caste, creed, language, culture, geography, whatnot? And then are we able to cover the entire spectrum of a population as such? Then are we able to maintain continuity? Because having comprehensive accessibility and coverage, but if we are not able to maintain continuity, because life will undergo different life cycles at different stages, starting from maturity to the mortality. In between, there is going to be change in all those things. Then, of course, the quality is very, very important. It has to be safe, secure, timely, in the same quantity needed, and it has to be person-centric, because human body is so complex, as we all know. and we all face, then it has to be person-centric so that we are able to really have better output from it. Then coordination of all those people who are the units or constitute involved into it in the routine and emergency setting, that is important, which is really in a situation like us, it is really a challenge to really ensure that we are able to coordinate properly. And then lastly, the accountability and efficiency part, because accountability, that is basically it is the answerability of a person on the decision taken as part of his responsibility and such. Because accountability, authority, and responsibility, they go hand in hand. Responsibility, that I'm responsible for making actions. Accountability, that I'm basically responsible for the results of the consequences of the action I've taken. And then it has to be efficient. That means we have to deliver more with less, because we need to consume lesser resources so that we are able to deliver better results. Right. Again, if we are basically creating a system, or we are interested in designing and deploying a system which is really going to ensure that preventive healthcare are made available easy, then it has to be thought from 7 C's assets, that it has to be credible, people really trust it, right? Then it has to be courtesy, so that people are able to relate and develop relationship with it. There has to be clarity, so that it makes the comprehension easier. Then it has to be correct, because if it is not correct, that people don't have confidence into it. And there has to be consistency, so that we are able to introduce stability into the entire healthcare delivery system. Then it has to be concrete. Concreteness is basically, again, reinforces them, whereas correctness builds the confidence, where concreteness basically reinforces the confidence, and it has to be consciousness as well, so that we are able to save on time. Right? Of course, this is going to be the last slide of my talk. So basically, this is the goal. Healthcare professional and service provider have a duty and commitment to enhance and restore healthcare quality. That's our challenge. That's our goal. We basically always aim at. This goal is achieved not just by single health professional, but multiple health providers who interact with the patient and family through the continuum of care, from health promotion and disease prevention to end-of-life care. And it is a complete integrated system wherein surgeons, physicians, dentists, physiotherapists, pharmacists, dietitians, public health professionals, occupational therapists, respiratory therapists, and whatnot, they basically work in routine as well as emergency situation. But ultimately, the goal is of meeting the need of individual, community, and population. That is how it is. Right. This is another challenge, that yes, if somebody is basically looking to be a preventive medicine specialist, the entire spectrum of healthcare is basically at his what we call as a canvas, and at his command, but they can play a bigger role. This is how it is. This is what I thought in a quick 10 minutes I'll be able to do justice to this.
Okay. Thank you very much for the wonderful and thought-provoking speech. Any questions? Chat box open. Any questions on the chat box? Let us. Okay. Thank you, sir. Thanks for the wonderful and thought-provoking speech, sir, particularly about the roadmaps and the paths we have to take when we implementing policies and systems in adopting preventive healthcare services in Health Sciences University, and finally ending up with how we can sustain those policies with the help of 7 C's also. So it's been a nice, inspiring talk, sir. So thanks for joining all the way from UK and spending your quality time, because we have a time gap as well. So yeah. I don't see any questions on the chat box. So if at all any question arises later on, we will get back to you, sir.
I'm here.
Okay, sir. Let us move on to the, can we move on to the next session, sir? Okay, so we will move on to the next session, which will be on session 2, which will be on enhancing preventive services through interprofessional practices and education, which will be deliberated by our Honorable Vice Chancellor, Professor Subhash Chandra Parija. He's going to be the second resource person. Sir is an eminent academician, erudite microbiologist, researcher, keen votary of medical education, and able administrator. He is a former director of JIPMER Pondicherry. Sir has authored 16 books, 400 plus research papers in national and international journals. Recently, he has been listed among the top 2% of the scientists globally known in the field of tropical medicine. And Sir is also FAO, WHO expert member on foodborne parasitic diseases. Sir has received Dr. B.C. Roy National Award from Medical Council of India in the year 2003 for his nodal contributions to the development of medical microbiology. Sir is the founder of Indian Academy of Tropical Parasitology. Sir has been confirmed with various fellowships that includes FAMS, FICAI, FABM, FIMSA, etc. Thanks for your valued time, sir, and we are looking forward for your knowledge on this particular topic. Thank you, sir. Over to you, sir.
Okay. Thank you very much, Dr. Sandil. Can you hear me?
Yes, sir. Yes, sir.
Okay. Thank you very much. Good afternoon again to you all. My esteemed colleagues and friends, Professor Rakesh Kumar Mudgal, Honorable Vice Chancellor, Dr. Y. Patel, Dean to University, Kolhapur, and Professor Ashok Mahapatra, Honorable Vice Chancellor, Sikhya Anusandhan, Bhubaneswar, Odisha, and Moderator Dr. Sandil, and all dear participants. At the outset, I take immense pleasure to welcome you all, in particular today's esteemed speaker, to this wonderful webinar on topic of interesting, that is increasing the delivery of preventive healthcare and its association with health sciences universities. I'm really thankful, Professor Mudgal, for having delivered a very nice, critical and thought-provoking component of the key features that makes the delivery of preventive service to sustainable. It has made my job much easier. So now today what I'm going to share my thoughts is on enhancing preventive services through interprofessional practice and education. So in essence, there are many concepts, many approaches that has been evaluated, tried for preventive services. Some may be traditional, being carried out through the ages, and now another new concept approach that is gaining momentum is interprofessional practice and education. So in next 20 to 25 minutes of my talk, I'll share what is this, what we understand by this interprofessional practice and educations, how it can be sustainable, and how it will help us to meet various challenges made by in this recent concepts. So today I'll be talking about, you please see it's moving or not, this slide. Enhancing preventive services through interprofessional practice and education. Is this slide moving, Dr. Sandil?
Yes, sir. Yes, sir,
okay.
It is moving, sir.
Okay, fine. That was some problem. Okay. So now, before I go into that, just I like to share how the education in all the spectrums, including health science education, has been evolving. I feel I am the product of traditional education. And traditional education has many characteristic features. One of them is it is teacher-centered. Obviously, subject-specific knowledge, and it is believed that it is the one-way transfer of knowledge from the teacher to the students. And of course, when it becomes one-way transfer of knowledge from teacher to students, it appears to be passive and obviously more theoretical. But when this basic concepts of this traditional educations over the years has evolved, and what recent education what we had, they're trying to make a paradigm shift to make it much more learner-centered, to make it more skill-based training, and focusing on more interactive learning and facilitating the learning teaching experiences by conceptual and practical training. Interprofessional education, what we understand by the term interprofessional educations. It means when there is education with collaboration of various faculties of different nature in implementing this program. For example, like the faculties of medicine collaborating with nursing, biomedical, dentistry, or health professions, who jointly they create and foster a collaborative learning environment. It means the collaborative learning environment earlier, now also is being mostly followed, is focused only to a particular faculties. If a faculty of medicine creates a system, it is mostly among their faculties. Same is true for nursing, dentistry, and biomedical science. But interprofessional education makes a sincere attempt to bring learners or health professionals from various faculties of medicine, nursing, biomedical science, etc., to create a curriculum for a collaborative learning environment. Because the most important outcomes of this interprofessional education is to influence the attitude and perception of students by reducing negative stereotypes to help overcome barriers to collaboration. And it is believed and strongly felt that common curricula in education can bring a lot of changes, which in turn will provide a frame of reference for collaborative practice among all the collaborators from different faculties. Of course, though this is the desired outcome, till now evidences are very less, though still is coming up, because limited research has been conducted. But definitely one systematic review that was published in 2007, it definitely shows there's a positive attitude and skills, attitude and beliefs among the learners who are exposed to the professional collaborations. In turn, has made a definite impact on quality healthcare. But when implementing this concept practice, obviously there would have been many barriers, because differences across schools of various faculties and students is one of the most important factors. Sometimes it becomes different from other faculties or other schools to align their thought with the main objectives. There is less evidence were there, and in traditional the way training environment is there, unless it will be changed. So this could be also unsupportive. So in this background, let's identify some of these components of interprofessional education in enhancing preventive services, the way very nicely has been presented by Dr. Rakesh. So interprofessional practice and education are important when seeking to respond to the growing demands for primary and preventive healthcare services. As Dr. Rakesh nicely mentioned, preventive services extends to various domains like immunizations against infectious disease, screening tests to strengthen evidence-based medicines for a better specific diagnosis, and other pre-formed evidences for having a good prevention of hypertension, or for a well mental health awareness, and to prevent substance abuse and oral health and so on. So now preventive healthcare, which is becoming one of the most important components of healthcare, is that preventive healthcare has many benefits. It can reduce the incidence of the chronic diseases, and of course, it also prevents the recurrence of the diseases. So it definitely contributes to decrease of the healthcare cost. But despite all these known benefits of preventive medicines, preventive healthcare, still it's unfortunate that the base of individuals that receive recommended preventive service is not that high. So evidence-based preventive services are effective in reducing death, morbidity, and disease, including many conditions, as I mentioned, welfare of the mental health, chronic diseases prevention, infection disease, and so on. Hence, what is the necessity for interprofessional team? We must understand that preventive services is a complex services. It involves synergy of various factors, including access to healthcare, cost of the services, timelines of the recommendations by the primary care providers, and above all, the capacity of the healthcare system to provide the needed care. Unless all these components are addressed, maybe these preventive services may not be that effective, which will include large number of population, and that's what happening. So one of the concepts that the interprofessional team appears and will play a very much important role in the delivery of clinical and preventive services. As I told you, it's a complex system. But in this system, the interprofessional team is well positioned, will be well positioned to address the complexities, various complexities associated with prevention-related practice, for example, by immunizations, population health management by public health experts, and care coordinations, and above all, access to health care. Hence, collaborative practice are being increasingly felt and needed to face the world's most urgent health challenges, overcome the health acts of the crisis. And the most classical example now we can share is that the way world has managed COVID-19 pandemic crisis. This is because of effective collaborative practices. And collaborative practices are also essential to enhance the region's capacity to respond to very health-situated issues. And another component is that this are needed to improve this and strengthen the skills of the health workers who provide these health care. This interprofessional healthcare is not a new one. It was already there, but it was not that much visible. Now it's become focused on designing implementations and evaluation of teams and education with improvement of health outcomes and educations. And interestingly, in recent years, this interprofessional healthcare is trying to gain attention because there is a good number of publications and scholarship papers that support, that contributes to the interprofessional education and practice and their value. Two important criteria for the effective implementation of interprofessional collaboration is a good leadership. And a good leader with his strong team, the members being drawn from various faculties, would be the most fundamental for a good interprofessional practice. In that role of leadership, a strong leadership cannot be underestimated. As you understand, leadership is strong, which inspires the team members, empowers committee members, and show directions for a change in the approach, and obviously sharing the vision for these changes. So the key characteristic of this strong leadership in interprofessional practice includes modeling and advocating for IP network, providing research and infrastructure facilities like training, incentives, and promoting shared team leadership goals and decision making. This is one of the most important contributions or component of interprofessional teams that contributes to the success of the program. And second is the team of the IP team, interprofessional team. Hence, the composition and structure of IP team is very much critical for good outcomes and desired performances. This should be what determines the composition of the team. Obviously, the patient care needs definitely is determine the composition of the team. So when we talk of first effective IP primary care team, so one has to understand, analyze, assessing the gaps in patient services and the needs of the patients, and for which number and types of professions should optimally to be developed to address these gaps. There is a lot of benefits from the IP team approach that supports expanding roles of the healthcare, delegation of tasks among various teams, and overlap of the roles. But essence is symptomological that by strong leadership and the composition of a good team, it might contribute to the success of the IP care. But the most important area of the concern is the financial component that would be contributing for the development and sustenance of the IP team and provision of the preventive services. Hence, while we're implementing, so there are 4 types of areas that have been identified for implementation of this IP interprofessional educations. One is systemic, that is behavior, attitudinal, and methodological behaviors. But in this context, continuing professional development and interprofessional educations, there has been an association between preventive medicine training provided by the healthcare organizations and implementation of preventive measures and patient-directed health education tools. So when there is synergy between the training and implementation of preventive measures, and patient-directed health education tools, it contributes to better outcomes. Now, when types of CPD we find out work-based learning, for example, facilitate experiential learning, in-service training, professional activities, augmentations by involvement of the professional bodies, or giving presentation at the conference, or networking with like-minded people, and educational activity that involves writing papers, gaining qualification, scientifics, self-directed learnings, and others like relevant transferable skills. So this of all these activities definitely facilitates for the integrations of the IP activities in healthcare course. So in essence, continuing professional development, that is educational and training for clinicians in practice, helps definitely to create and enhance skills, access, and enhance knowledge designed to maintain professional competency and qualities, and that results to build confidence of the clinicians in the practice, and with a better outcome, obviously, it contributes to job satisfaction of the clinicians. CD is specific to practice knowledge and skills such as preventive services and population health, as well as IP teamwork competencies helps definitely support collaborative practice to really healthcare providers. And in essence, the concept of IPT-based competencies, practice in this settings of IPT-based competencies and clinical content definitely will contribute more to the benefit of the patients. To summarize, in this evolving changes in the way we deliver healthcare to the patients who need them the most, there are various concepts, approaches. Definitely, one of these approaches of interprofessional educations with collaborations among different faculties across the health science universities has the potential to have a more desired outcome. Unlike any other concept, obviously, it won't be that smooth to implement. But definitely, when one has to evaluate this interprofessional education, one has to accept them and to live through them. To conclude, healthcare delivery in coming years will definitely increasing on primary care and emphasis on prevention. There is no doubt it is well accepted fact. But access to quality primary care and preventive health service is definitely associated with improved health outcomes, as understood. Hence, the provision of primary and preventive health care is collaborative and a multifaceted process. That most important we have to understand and share, because after all, the more interprofessional collaborative becomes, and through various multifaceted process, definitely there's no doubt it will improve outcomes of the clinical practice and definitely reduce health disparities for communities, populations, as well as individuals. As healthcare model changes and flex to meet the needs of individual and population, the healthcare workforce must be able to adapt, because it's a growing, evolving space. Hence, the challenge in healthcare delivery system is the aptness or adaptabilities of the healthcare workers to the systems for benefit of the patient's healthcare. Hence, providing healthcare professionals and students with knowledge of interprofessional competencies and creation prevention of population will help the primary healthcare for the futures. And it's a topic of interest, definitely needs more in-depth analysis and study and get maximum benefit out of this concept for patient healthcare. Thank you. Thank you very much.
Thank you, sir. Since we are running out of time, any questions are there? Put it in the chat box. We will try to entertain at the end of the session. Thanks for the enlightening talk, sir, and your way of presenting how the evidences need to be collected for the establishment of interprofessional practices in education in a healthcare university. And the barriers which needs to be addressed also. And I'm sure, because I've been associated with our Honorable Vice Chancellor for last 3 to 4 years, and sir is one of the good leaders in establishing new system, and he has taken up a lot of challenges in sustaining also. So his word of wisdom would have enlightened all the youngsters who are going to be the future torchbearers of the interprofessional education. So thank you for the enlightening speech, sir. So we'll move on to the next session. So the next session is the last session for this today's SBV Connect. And the title is on policy and implementation strategy and recommendations to further the delivery of preventive services in Health Sciences University, which will be deliberated by Professor Ashok Mahapatra. Sir is Honorable Vice Chancellor of Shiksha O Anustandhan University, Bhubaneswar. Sir completed his MBBS in 1975 from MKCG Medical College, Berhampur, Orissa, and Master of Surgery and MCH in Neurosurgery from AIIMS. His interests are included pediatric neurosurgery, head injury, and skull-base surgery, among others. Sir has 30 research projects, done 30 research projects in the last 40 years, and he has authored nearly 900 papers, chapters, and books. Sir has formerly hold various posts in the Government of India. That is, he is the head of Neuroscience Center and Dean Research, AIIMS, formerly, and he's a former director at AIIMS, BBSR, former director, SGPGI, Lucknow. Sir's interest includes pediatric neurosurgery, head injury, and skull-base surgeries. Sir has won several awards, including gold medal in pharmacology and Dr. G.O.V. Desai gold medal for research in neuro-otology. He was confirmed with the prestigious Dr. B.C. Roy National Award in the year 2007 in the category of eminent medical teacher. Sir, over to you, sir. Thank you very much. Sir, you're kindly unmute yourself, sir. We are not audible.
Yeah. Thank you very much.
Yeah, thank you, sir.
I think I thank the Chancellor, Vice Chancellor Parija, our co-speaker from the D.Y. Patil University Vice Chancellor, organizers, and everybody for discussing such an important topic. There can be several international conferences in these topics. So to cover the topic in half an hour is not possible. Yet I will give a bird's eye view to the topic. Before I start, it is very important to know the medical history of India. Till late part of 18th century, there was no medical college. The doctors came from UK to treat the East India Company people. It's the first time, 1835, the Madras Medical College, Calcutta Medical College were created, followed by Grand Medical College, 1845, and other medical college. By time of 1900, we have 7 medical colleges, and at time of independence, we have 14 medical colleges. If you go to medical history of India in the preventive aspect, in November 15, 1911, Indian Research Foundation Fund Association was created. That was to do the research in public health in India. 1929, All India Conference of Medical Research was started at Calcutta, which was subsequently converted to tropical hygiene, tropical medicine and hygiene. Currently, ICMR started in around 1947 and just post-independence. And today we have 29 different institutes under ICMR, which is a part of health science research under a separate secretary who happens to be DG of ICMR. We have Tuberculosis Institute, Research Center for Cholera, Leprosy, Diarrhea, Viral Disease, AIDS, Malaria, Kala-Jar, Vector-borne disease, nutrition, whatnot. we have really taken all preventive steps to see the health statistics of India improves. In fact, it did. If you look at the health statistics over the last 150 years, when the Mahatma Gandhi was born, that time the life expectancy in India was 28 years. When India got independence in 1947, the life expectancy in India was 32 years. Today, our female ladies in India survive 71 years and gents have a longevity of 69 years. This thanks to this pandemic, which has reduced the age all over the world by 2 years. In US is 2 years, in Europe is 1.8 years, and in India is 2 years. So we have to see how the healthcare delivery system in the world has gone developed, including the healthcare delivery system in India. Preventive aspect is a very important aspect of India. If you ask for a impartial criticism or assessment, India has done very well. But you have to do the implementation and all this. Could we have done better? Yes, we could have done better. For everything, there is a downside and upside. Nothing is 100% perfect. So if I have to give mark to Indian healthcare services, I'll give 80%, not 100%. So we could have done 100%. As the students are getting 99% mark in 12th class, you don't get astonished to getting 99% mark. So why do you expect 99% mark getting for healthcare? It's difficult. It all depends on goal of prevention. I think is to decrease the morbidity and mortality, reduce and minimize the risk, increase exposure to protective factor, and reduce the socio-economic burden. We know that even with the best of the effort today, the out-of-pocket money spent by a person is 62.5%. The health budget has increased from a 0.6% to almost 3% to 4%, of which about 50 to 60% are private sector. So we have not spent enough in a healthcare delivery system. So I think the slides are stopped.
Slides, now it's not moving, sir.
Can you know, it's now stopped. Just 1 minute, just one. So we know that.
Yeah, now it's moving, sir.
Moving. So they're called health. If you look at the, we require a lot of things. Okay, now I will start here. So we have a primary prevention, secondary prevention, tertiary prevention. We all know that. So I quickly go through the basic to the strategy. It needs leadership. Both our previous speaker has given due regards to leadership. It is a leadership of the state, the center, the district, in the medical college, in the periphery. The leadership is not confined to or concentrated to one person. If a system has to work, the leadership starts from the top to the district and grassroots level. Otherwise, even your policy is not going to work if the community medicine, community center or the CSC or the primary health center doesn't work, because our ultimate aim is to make the primary centers more effectively deliver the goods at the grassroots level. So it is a communication, feedback method, policy development, review, implementation, all these part of a strategy which lead to a successful project. In this project, we have the vision, you have a managing of position, gathering the evidence. If I have to have project on any disease, I have to have background knowledge of the what is existing, what is deficiency, what is the gap, and what is to be done. So policy will depend on many things. We have created so many policies which are beautiful. Maybe it is the tuberculosis control program and nutrition control program, ICDS, even the vaccine policy. Many things are successful in India and many are not. So there is a lot of things we have to really do the manthan to find out what. So health is a most important thing, as the preventive health can reduce the cost of the healthcare services and give a very good healthy society. So it is very, very important to understand, if you do not spend 5 rupees for prevention, you have to pay 100 rupees for curative purpose. So it is important to understand how disease can be prevented. Vaccine is a very good example. By vaccinate before the vaccine started, a lot of people all over the world died. After the vaccine has come, even the wave 3, wave 4, wave 5 abroad has not killed many people. So that's a very important thing how to understand. So health of the society is not a single parameter. It is economic stability, health statistics, educational status. I cannot compare US with India when the education standard and infrastructures and environment and sanitation are not good. So we have to understand we cannot compare apple with orange. So we have to have a high happiness index, high health indices. For that, we have got to even law and order. When a lot of people get in riot and get pollution and many things, that also part of affect the healthcare delivery system. We need professionals. India needs 18 lakhs of doctors and 20 lakhs of nurses. India has created in the last 75 years only 7 lakh doctors, and only 2.5 lakh doctors have left the country, superannuated or passed away. So we are grossly deficient in, so the policy of health education has failed. In Odisha, for 50 years, there are only 3 medical colleges. So it's not a poor policy that we never spent, created medical colleges. So it all depends what is the attitude and temperament of the political masters. So you have to have a professionals, adequate professional in the form of doctors, nurses, technicians, paramedics, social workers, and also field workers. So health services delivery at the grassroots level in the form of preventive health care has to have a big network and manpower. You cannot achieve this. So you require knowledge, personnel, roadmap, strategy, implementation, audit, and everything. Otherwise, your project is not going to work. This has been discussed extensively by our management side from the D.Y. Patil. So health promotion is very important. How to promote him? We have a roadmap that is called strategy. Without a roadmap, you cannot deliver. And once you deliver, you have to implement successfully. So these are to have very significant contribution to our ultimate result. So goal of prevention could be decrease morbidity and mortality. We have seen that in vaccine giving a wonderful result for the COVID. We have AIDS. Many things have AIDS. We expected in 1970s, AIDS will be killing thousands of millions of people every year. It didn't happen. So there are long strategy of preventive aspect. Reduce to minimize the risk factor, many risk factors. It is from healthcare to infrastructures to nutrition to sanitation. It's not one thing which reduce the factors, multifactorial. Reduce the socioeconomic burden. If your per capita income is low, you cannot have very high quality healthcare delivery system or preventive, you require money. That is the reason poor countries have done poorly than the rich countries. So health promotion is multifactorial. It has to have a disease prevention, public health strategy, disease preventing nurses. We have no paramedic and nurses which can go to the grassroots level. We have no medical social workers. Where are the social workers? Who is going to deliver the health hygiene, hand washing, environmental hygiene, screening of the diseases? These are not a job of doctors. That has to have a huge infrastructure, manpower, who can deliver this in the grassroots level, district level, and state level. And health being a double thing, state government charter and the central government, it has a tremendous cooperation. A policy passed by the government of India may not be taken up by the state government. The example is that when the Prime Minister health 5 lakhs rupees is given, many states did not take the advantage. The question is that the health being the dual chapter, double responsibility, a state CM may not accept it. So it prevents the supportive environment, developmental skill, and the infrastructure because they don't take the support because of whatever reason it may be. Public health strategy requires the food, sanitation, drinking water, improve sanitation. So it's a multifactorial and it cannot be done in a decade or when we started independence, we did not have 50 crores of rupees for India to give compensation to Pakistan. So if you look at that 75 years journey, today India is the 5th economy in the world. It is nothing but to improve the healthcare delivery and education system in the country. And that has happened. Very happy situation. Disease prevention requires a lot of nurses, their training, their education, their attitude, their temperament. So 3 types of nurses are required: primary, secondary, tertiary prevention. That I'm going to give a little later. So we have healthy body, healthy mind, so require to prevent diabetes, blood pressure, overweight. While we have got good policy to control tuberculosis, smallpox, malaria, typhoid, cholera, we have achieved success. But on the other hand, we have not completely have a victory over the communicable disease. We still have 30 to 40% of our public coming with communicable disease, and about 60% come with diabetes, blood pressure, lifestyle disease. So there is no food lifestyle is destroyed. They don't have working and sleep cycle has changed. Life history and lifestyle has changed. Food and sleep habit are changed. This is the educated mass who has enough knowledge about our good health. So here the motivation and awareness is not important. Education is not important. It is the most educated people. Those who have body mass index is very high. Imagine the India has a BMI of 32, and 32% are people in India are overweight, where the 40% are underweight. So our nutrition has not reached the grassroots level to give everybody 100% nutrition. On the other hand, we have 40% people have become overweight. A state like Odisha has 33% overweight people. So it has disproportionately gone, and it has not really related to too much of education and degree. The overeducated people are sometimes do not follow the lifestyle. So you have to have prevention at different level. That is regional level, national level, and community level. The community level has to really reduce mortality, morbidity when it goes to, and it is give benefit to grassroots level, village level, tahsil level, and panchayat level. So have we achieved that? Yes, we have achieved to some extent. Nutrition status has improved. The healthcare delivery system has improved. The longevity has gone up. But when I see the people at 70 years, about 15 medicine taken by the people at average 70 years. And when I do the health camp for the 80 years and above, super senior citizen, they are taking more than 15 medicines. So they have diabetes, blood pressure, overweight, gas problem, anxiety, depression, sleeplessness, arthritis, whatnot. So it is quite natural when the longevity will go up, the geriatric problems will arise, and our healthcare prevention system will also has to be tempered to the geriatric age group. So that include lifestyle, no smoking, no alcohol, better spiritual health, which nobody talks about, even though WHO gives a lot of significance to spiritual health. So our program should be elderly oriented, infant oriented, youth oriented. Today we are talking about adolescence health. I have to give a lecture on adolescence health. We never thought about the children between 15 and 18 years or 20 years. What type of psychosocial, physical, and mental stress they go in, and what type of disease they manifest. So you have to have policy for the adolescence health. So program, policies, media campaign, change in behavior of the people, and lifestyle changes are all required to have a preventive of healthcare, success of preventive healthcare. This is multi-factorial, multi-directional, multi-level, and our country being multi-religion, multi-ethnics, multiple state, having both state and center participation has not good coordination. So we have to have a coordinated function that Dr. Parija and Dr. BC from the DY Patil was speaking about. The surveillance, outreach program, screening, referral, follow-up. We have blood pressure, 25% people have blood pressure. And if I see our health clinic, large number of people come with heart attack and brain hemorrhage at age of 35 and 40 years. That is because they develop blood pressure at the high school. When I do the camp for the high school student in my villages, I get 15% are pre-diabetic and 15% are hypertensive. When we studied the AIMS Bhubaneswar 550 nursing and MBBS students, we found that 48% are pre-diabetic, 26% have blood pressure expected, normal expected for the age. 40 to 50% people don't sleep before 2 a.m. So what is their mindset? Depression, hypertension, overweight. They're the medical student of AIMS Bhubaneswar. So the question is that wow, we have had our elderly and the young people are maximum sufferer. So we have to have screening, health screening, which doesn't exist. Preventive checkup doesn't exist. People come for first time with brain hemorrhage and heart attack. They never have check up their blood pressure in their lifetime. First time they come with brain hemorrhage. So these are very, very important because that doesn't reach the grassroots level. Food and water safety, hand washing, we have all disinfection, cleanliness, sanitation, very much highlighted during pandemic. So not much to talk about. Decrease the tobacco use. Even it is written for last 50 years, tobacco smoking is injurious for health. We people still smoke. It is poor people smoke, intermediate income people smoke, and aristocratic smoke. So it has education, money, poverty has nothing to do with the tobacco smoking. 1 million people die in India with cancer or smoking related disease like upper respiratory infection, lower respiratory infection, gastric cancer, liver cancer, and lung cancer. Nothing has happened, really nothing has happened in the last 20 years. Even though the government offices have become smoke-free zone, people smoke in government offices. So the question is, how do you prevent when the people attitude is wrong? We have social aspect, we have human aspect, we have grassroots level work activity, make them understand their role. It is not the government who can deliver all healthcare delivery system. Here the central government, state government, healthcare delivery professional, social worker, and above all the citizen of the country has to cooperate. When the citizen of the country are educated, smoke, educated and drink, and do the overweight, knowing that body mass index high will create problem. I always tell the people, overweight mother of all diseases. Blood pressure, diabetes, depression, snoring, sleep problem, arthritis, spondylitis, name a disease which is not. Yet it is difficult to make them understand. Somebody will tell me that I was 95 kg, I have reduced 10 kg. I say, God help you. You have become from robber to a dacoit to thief. You have to become a pickpocket and then become a good human being. So giving an explanation that I was 85 kg at age 60 and 70 years I have lost 10 kg to become 75 is not good enough explanation by an educated, rich, affluent man. Address social aspects. How the diabetes and blood pressure is the 2 killer disease. Number 1 is heart attack. Second is the brain hemorrhage. Third is the cancer. We have enough data to say that blood pressure, diabetes, cancer are 3 killer of the world. Cancer, we can prevent smoking. We have a good hygiene. We have got pap smear for the cervical cancer. We can have a mammography. All are existing. Yet people do not take advantage. There are affluent people, rich people, well-to-do people. So their attitude has to change. Their temperament has to change. The more concentration on the awareness and their suffering. So if we do not make them understand how a cancer patient suffers, how a person suffering from tuberculosis suffer, we are talking about preventing or eradicating tuberculosis in 2030. Is it possible? 5 million people die in India of tuberculosis every 5 lakh people die in India in tuberculosis. We never had the creation of we have created multi-drug resistant tuberculosis because our planning was well, our strategy was well, our implementation was bad, and people are not cooperative. When I gave 1 year for tuberculosis medicine, they took for 6 months and told doctors are bad, they are unnecessarily giving for 1 year. They did not understand it is tuberculosis such a dreaded disease that it can kill if a haphazardly treated. Not only that, it has produced multi-drug resistant, extreme drug resistant, and total drug resistance. So this is very important. In primary care, we know vaccination, avoid contact, nutrition, lifestyle. Very, very important. Secondary prevention, screening of the people, mammography, overweight, heart attack screening. The TMT is a very good screening, but people won't do it. That is a preventive health care. For the IS officer, IPS allied officer, and defense services above 40 years, they have to annual health checkup. None of our doctors do that. In Sanjay Gandhi, when I told our faculty to have an annual health checkup, they told director is making unhealthy. They did not cooperate for their annual health checkup. So whom are going to teach? The doctors, the nurses, the educated? No, it has to require an attitudinal difference, the understanding and lifestyle changes. Prevention, disease, immunization, hygiene. We have talked about hygiene and immunization. Very good example of immunization and smallpox eradication, tuberculosis, TB vaccine, and also typhoid eradication, cholera vaccine. Whenever children, we are taking cholera vaccine twice a year during Car Festival and Ganesh Puja. So the question is that a lot of disease we have controlled, yet we need a lot more things to be done. Eating habit, very high cholesterol. We know that overweight is due to rich food. We do not bother for food, and that is mostly affluent and rich and educated people smoking cigarette and taking alcohol. So how will you prevent smoking cigarette and alcohol? With education and all these things have not happened. So 3 types of prevention I have told: primary, secondary, tertiary, and quaternary. And this all depend how our strategy being implemented, how the central government, state government, people, administrator, healthcare delivery people, and above all citizen of country also cooperate. Without the cooperation of citizen, you are not going to achieve the success. So in consultation, of course, that's very important. Tailor-made policy. We have seen the vaccination, tuberculosis, cholera control program, malaria control program. They have been there for many years and have given mixed result. Step to study the requirement, risk and result assessment, optimizing the alliance of documents, no false document, no bogus document. We have done this, we have not that, nothing. True, hardcore, successful, credible documents. Otherwise, you will be fooling the people. Policy implementation, Eureka resource, budget, which was very little in India. Institution, with very few institutions which are preventive health aspect. Institution rules and regulation, they are all by the rigid rules. They can implement without the higher authority or political boss advice. We have seen in the vaccine. Today, ICMR told for our vaccine, which we took about 6 months back, is effective of Delta 2 and Delta 1. If the vaccine is only tried for 4 months, how can it be effective after 1 year? I don't understand. So you cannot just follow political master's plan. Poorly designed policies. Many policies are designed poorly. One of the policies is vaccine. When every country was spending money and planning for vaccine, India did not. But when you wake up late in March 2020, it was too late. That is the time when 300 crores was paid to Covaxin and also Serum Institute of India. We have never planned. We thought our meditation, our herd immunity, our body immunity is very high. We will not suffer. That was the concept of the people in the higher authority. So we have successful project ICDS, oral polio, many things, roadmap and strategy implemented, and preventive network is good. We have controlled many diseases. So it is not all failure. Family planning, partially success. It is the first country in the world, wrongly policed, wrongly implemented, wrongly strategies. In mid-70s, when the Sanjay Gandhi was active in health, it became a political issue and the Congress party had to lose. The question is that it cannot be politicized. The prevention of disease is more of a technical and professional than the political influence. Quite failed. Multiple factors, lack of political will. wrong attitude of government at government, district, state government, central government, district authority and citizens. Lack of robust policy, lack of infrastructure, no doctor, no nurses, no technician, no social worker, no cancer awareness program. There is no cancer coordinator in the district level, sub-division level, CSC level. Effective intervention, failing, no intervention, no study which is credible. In conclusion, India has done very well. In the last 150 years, we have gained almost 42 to 45 years of life. Yet we are sick, having our high blood pressure, diabetes, overweight, cancer, and many diseases, smoking, alcohol. So it is this multifactorial cannot be controlled by central government, state government, or anybody. The absolute cooperation of citizens is very important, because infrastructure and implementation may be part of the government policy. But if a policy and implementation citizens do not follow it, then it doesn't happen. We do not have enough trained doctors, nurses in the public health programs. I want to have a public health center at Baleswar. It did not happen. After the project approved, it was not materialized after I left. So it all depends on a man who sits on a chair and see what is important for your institute or not. So here the director of institute is also important. Your project by the previous director should not be taken as an evil's eye. How the things will work if successive government contradict each other, if a director contradict each other, if the one politician contradict each other, they have to have cooperation. We lack cooperation, coordination, and implementation. We could have done well if we were to work as a unit, state and center, the state and the medical colleges and district level and the primary health center. We have not been able to coordinate in 100% manner. So our success is about 70 to 80%. Thank you very much. I'll be very happy to take questions.
Thank you, sir. So since we are able to finish exactly at 4 o'clock, thanks for your wonderful and your experiential talk about the positive health initiatives and what are all the failures where the government of India has faced and all these things. So all these experiences will give us a lot of knowledge when we move forward in implementing new strategies, because we always learn from failures and we always cherish the outcomes also. So thanks for the wonderful lecture, sir. And
we have two questions in chat box. Can you show that?
Yeah, there is one comment by Dr. Swati Pawar. So Madam has said, completely agree with Dr. Mahapatra, sir. Indian physician long before the British colonization focused on how to prevent the disease before it happens. However, a host of disease trouble our current generation due to poor nutrition, poor mental and emotional health, which are only being taken care through drugs. This can weaken our body's immune system and make them susceptible to lifestyle related disease. True, as of now, as a consumer, continue to gain more awareness and access to healthcare information over the internet or via alternate media, the chance of increasing life expectancy will also improve. India has an unprecedented opportunity to become a healthy nation with the ability to take the right preventive steps. We should change the dichotomy that Indian doctors are best, but Indian healthcare is not up to the mark. Preventive health begins at home, in the schools, in the office, and the PMOs.
He has written a history and essay.
Sir?
He has not asked a question. He has written a history.
Yes,
Let me tell one thing. I will interrupt here. The government created Ayush, Ayurvedic, homeopathic, Unani, but people do not take it. We had a Ayush hospital in every AIMS. I appointed Ayurvedic doctor, homeopathic doctor, yoga teacher, Unani teacher. They have all disappeared. People did not like them. So attitude of the citizen, you talk one way and do another way. The madam who has taken it, can he manage without vaccine? Ask her, was vaccine necessary for her COVID prevention? I had taken 3 times vaccine. I suffered 3 times COVID. In 2020, I had COVID in August. 2021 May, I had August. At 2022, I had Omicron in January. I never stopped working as a doctor. We have 2,700 beds of COVID. It's 6 hospitals. Well, I cannot say this because if that is the true, we are talking like Ramdev Baba. You are not talking like Ramdev Baba gave prophet, coronal aa gaya hai, everything will be cured. Doctors are giving vaccine unnecessarily, and no central government employee commented. It was supported by no less than person Harshvardhan. They are complementary to each other.
Okay.
Improving the immune status is paramount importance. But if I have appendicitis and take Ayurvedic medicine, God help us. You have to go to doctor's knife when you need. So here the intelligence, judgment, timely intervention is very necessary. I cannot put everything in one basket and say it is wrong or bad. Yes, I promote Ayurvedic medicine. I promote homeopathic medicine. I go to Ayurvedic medical college, homeopathic medical college. But I tell them, choose your judgment and disease in appropriate time. When it's too late, people take Ayurvedic medicine for brain tumor, come in coma. What do I do?
Okay.
They take Ayurvedic medicine for the meningitis. When they are grade 4 coma, fixed dilated, they come in hospital, and the medical hospitals take blame. You understand that?
Yes, sir.
So
Yes,
it is
sir.
a
Thanks for your
tremendous
word
role
of
the
wisdom. I think.
health education.
Yes, sir. Thanks for the word of wisdom, and your word shows your experience, sir. Thank you very much. And since we are running out of time,
Dr. Parija and me did MBBS, joined MBBS in 1970.
okay. Thank you very much, sir. So we will receive the
Another
questions
question. Another question. The two questions for me.
Okay.
They do not write history. Question should be pointed with a pointed answer. If you
There
give
is another-
elongated history,
Yes, sir, it is only
lengthy.
Yeah, thank you very much for the enlightening lectures for SBV for FESI.
Thank you very much.
It is only thank you, sir.
I think it can be 2 days, 3 days international conference, not 1 hour seminar. It's like a topic seminar for postgraduates. Okay, thank you very much.
Thank you, sir.
God
Any
bless you.
more
God bless
questions?
you.
We will receive the questions and we will contact you in person, and we can get the
No
answers
problem,
and
no
share it to
problem.
them.
Thank
Okay,
you.
sir. Thank you for all the 3 resource persons for spending their whole afternoon.
Let me thank Dr. Parija and Dr. Mudgil. I
Thank you,
think
Thank
it
you,
was
sir.
a wonderful talk. I thank them from my bottom of the heart. Thank you.
Thank you, sir. Thank you so much. And we'll create
Thank you
some
also.
activity of you.
Thank you
having
also
here.
for your coordinating this talk.
Okay, sir. Thank you. Thank you very much for all the 3 resource persons for spending their entire time with Sri Balaji Vidyapeeth on SBV Connect. So we will close the session. We will meet you in another SBV Connect in the coming days. Thank you very much and
Thank you.
holding us with us. Thank you.
Thank you.
Thank
Thank
you.
you all.